Well, if we focus on the priorities for mental health and data, our key priorities for the next 12 months are to improve our coverage and completion of the data set. We've just implemented a new infrastructure to improve the timeliness of our data, and we want to make sure that we collect as much data as we can so we get a much broader coverage of all mental health providers. We think we have all of the very large providers, but obviously there are many smaller providers, and we want to make sure that we support those to submit data to ourselves. So in terms of increasing coverage, we will then want to make sure that access to our data is as easy as possible. So we make data available in quite a few ways. First of all, we publish data, and we want to make sure that we publish data every month as quick as possible. We make some routine extracts available to everybody, to providers, to commissioners, etc. And we want to be reducing the time it takes to deliver those extracts. And we also make specific data available to, for example, researchers who ask us for a specific set of data. And we want to make sure that we can turn those requests around and deliver that data to people much quicker. The implementation plan includes a lot about joined up care, so not just mental health but also physical health. And our survey from 2017 showed very strongly there is a link between the two. So people with severe mental illness are much more likely to have physical conditions as well. So in terms of the biggest impact, it's going to be around joining our data together. We collect lots of data based on care domains. So we collect data on maternity, mental health, learning disabilities, hospital services, outpatient services. By joining all of that data together, we can give a much more, a richer understanding of the services which are provided at the moment, and a much better view of how we can improve certain areas. We can then start to use that data and start to use bringing much more artificial intelligence, much more decision support type tools, so add a lot more value. We've previously looked at reporting what's happened. We can start to look at predictive analysis, we can start to look at decision support and using our data in quite innovative ways. I was very pleased that I got so many questions after my session. I'm very pleased that there was a queue of people who wanted to speak to me about data, which was quite unusual. I think the personal highlight I would take is I never realised how important knitting was for mental health, and I even managed to get an anecdote about Sylvester Stallone and knitting into my talk, which I was quite amazed about. I couldn't quite manage to connect knitting with data and mental health, so I didn't quite connect the three things together, but I think getting two of them isn't too bad.